Cri du Chat, a genetic disorder. What is it? Cri du Chat is a rare genetic disorder. It was named by Jerome Lejeune and is French for cat cry. It was discovered in 1963 by the same man. It's caused by a piece missing in the short arm of chromosome 5. The disorder causes children to sound like a cat when crying, and also causes other physical deformities. For a kid with Cri du Chat, life is very difficult. Physical deformities caused by the disorder, such as the inability to swallow, make it harder for kids to get basic things done. Many devices have been used to make sure they are able to get their basic life needs. Some of these include feeding tubes, bottle feeding, regular suctioning, and administration of oxygen. Usually kids with Cri du Chat are diagnosed at birth. This is because the crying the babies make when they are first born is a high-pitched cry that sounds like a cat. They also have a small head and a flattened bridge of the nose. Another way children can be diagnosed is through a specific test called the fluorescence in situ hybridization, acronym FISH. Another type of diagnostic test that can be used to determine the extent of disorder would be X-rays to reveal if the child has scoliosis, which can be a skeletal complication of it. If Cri du Chat affects 1 in 37 to 50,000 children born across all ethnic races. It is more common in girls than boys, with a 4 to 3 ratio. In the United States, 50 to 60 kids are born with the disorder every year. It affects children from birth until age 1 to 2, which then the cat cry starts to wear off. Cri du Chat is caused by a partial deletion of chromosome number 5. This disorder is not a result of anything the parents have done or failed to do. 80% of occurrences are traced to the father. Symptoms. Symptoms of the disorder include low birth weight, failure to gain weight, high-pitched cry that sounds like a cat, low muscle tone, cleft lip or palate, webbing of the fingers or toes, small head and jaw, and abnormally round face. As the kids start to grow up, they may experience behavioral issues such as tantrums or poor attention and impulse control, seizures, hernias, kidney or urinary abnormalities, autism-like behavior, constipation, and trouble sleeping. Prognosis and treatment. The mortality rate for children with Cri du Chat is about 10%. 75% of the deaths occur within the first 3 months and 90% within the first year, so the prognosis becomes better following the first year of life. Mostly, there is no cure for Cri du Chat. The treatments for it mostly help the child reach his or her full potential and help their quality of life. Some of these include physiotherapy to improve poor muscle tone, speech therapy, communication alternatives such as sign language because speech is delayed, and occupational therapy to teach coping strategies.